So this is a presentation about the bony pelvis and the hip joint. That's me. So the pelvis is obviously the central part of the body. We've got two diagrams here. The one on the left shows the spine, the pelvis and the legs from the front, anterior posterior direction, and the one on the right shows a lateral view. I'm going to add the line of gravity now, here and here. I'm also going to add the center of gravity of the body with this apple. So you can see that the center of gravity falls just in front of the second sacral vertebra, which is sort of in the middle of the pelvis. That's pretty important. Here we've got a representation of the internal organs in relation to where the pelvis is, and I always think of the pelvis as a ladle holding the internal organs. The handle of the ladle is the spine, and the squishy bits are sitting inside the pelvis, so obviously this would be the intestines and some of the reproductive organs as well. These diagrams show in yellow on the left where the weight's transmitted through the upper body, through the pelvis and down to the leg, and on the right we've tried to show you here how the pelvis is three separate rings. Also, obviously the pelvis has a lot of muscles pulling on it in various directions, so it's very important in terms of core stability. This is to try and illustrate that because the pelvis is a ring, quite often a ring will break in two places. So this is an x-ray of a pelvis that's broken in two places. This was an elderly lady who fell onto her bottom, and she's got a fracture of the superior and the inferior pubic ramus. You can see them highlighted with red here. Going to take you on a guided tour of the main bony bits of the pelvis now. So this is the pelvis from the lateral side. If the pelvis is the first bone you've learned about, don't panic too much. It is quite a complex bone. It's quite difficult to get your head around. But the bits that you can feel are here, the iliac crest. There's an anterior superior iliac spine. There's an anterior inferior iliac spine. There's a posterior superior iliac spine. A posterior inferior iliac spine. This is the acetabulum. This is where the head of the femur actually sits. And around the outside of that we have a labrum, which makes it deeper and more stable. This hole is called the obturator foramen, and it's covered in life by the obturator membrane. This L shape here shows the pubic bone, so we've got the top part, which is the superior pubic ramus, and the bottom part, which is the inferior pubic ramus. This is what was broken in the lady on the previous slide. We've got a bony point here called the pubic tubercle, and the bit that you sit on where your hamstrings attach is called the ischial tuberosity. Male and female pelvises aren't the same, so I've shown you here the differences in the pubic arch. You can see the difference in the angles between a male and a female. Also you can see the size of the pelvic inlet is smaller in a male than a female. Obviously that's to facilitate childbirth in a female. Again, there are other differences between a male and female pelvis. Female pelvis, shown here in pink, is more round. A male pelvis is more angular. And if you look at the elbows here as well, the female, because the pelvis is wider in proportion, the female elbow has a broader carrying angle. So I've tried to illustrate that there in yellow, whereas a male's elbow goes straight down. Obviously, everything's a continuum. It's not always as cut and dried as that, but that's a general rule for the shape of a male and a female. This is the pelvis from behind. Just talk you through a few things that we can see here. So the first thing we can see is the sacrum. The sacrum is called the sacrum because when they used to burn witches at the stake, it was the last bone left, so it was thought to be sacred. This is one of the ischial tuberosities. This is where the head of the femur would sit, and this is where the spinal column would sit. Underneath the sacrum we have a coccyx, which is the remains of a vestigial tail, hence the little tadpole. The pelvis itself is made of 3 bones, which are fused together in an adult, but separate in a child. I've got an x-ray to show you later. The bones are the ilium, the ischium and the pubis. The joints around the pelvis: there's a joint at the front in the centre called the pubic symphysis, 2 joints between the sacrum and the iliac bones at the back, and obviously 2 hip joints as well. So these 3 lines show you the top 2 are the sacroiliac joints, the bottom central one is the pubic symphysis, and here's one hip joint, and here's another hip joint. So we're moving on to the hip joint itself now. The thing about the hip joint is that it's sometimes called the coxal joint. The hip joint is very mobile but also very stable. It's a very, very strong joint, and it takes a lot of trauma to dislocate it. That's not the same for hip replacement. They dislocate relatively easily, but a normal hip joint is very resilient. I've only ever seen 1 or 2 that have dislocated through trauma, major car crashes, and one was a rugby player who fell awkwardly and was squashed by a 20-stone guy. You can't palpate the hip joint itself, but you do need to know where it is, so I'm going to talk you through that in a few seconds. The way that I think of the hip joint, it's like an egg in an egg cup, which allows the egg to swivel in every direction possible, and I've tried to show you in orange here the labrum which holds the egg in even deeper. If you compare that to the shoulder joint, I always think of the shoulder as a football on a saucer. The football is too big for the saucer and it's prone to roll off, so the shoulder is less stable than the hip joint. This is what a child's pelvis looks like on the left compared to an adult's on the right, and I'm going to show you a few things here. Can you see here a gap in the acetabular floor? That's where the bones join together. That shows that this skeleton's not yet skeletally matured. You can also see a growth plate in the femoral head, which means that growth has not yet finished. And you can also just about see that there's actually a growth plate in the greater trochanter as well, so you can identify this as a child's skeleton. This is how you find the hip joint itself. So if you draw a line from the anterior superior iliac spine to the pubic tubercle, that corresponds to the inguinal ligament. Then if you draw a line halfway down, directly down about 1.5 centimeters, that corresponds to the center of the head of the femur, so that's the marking of the hip joint. The thing about the hip joint is it's multi-axial, it's got a synovial membrane, and it's a ball and socket joint, which allows it to move in 3 degrees of freedom of motion. The capsule that holds things together is very, very strong. On the inside of the capsule you have a synovial membrane which secretes synovial fluid, and basically you can divide the capsule into 3 different sections. You've got a pubofemoral ligament, an ischiofemoral ligament and an iliofemoral ligament. There is also a ligament inside the hip joint as well called the ligamentum teres, which goes from the depression in the head of the femur, which I've tried to show you with this little finger. So the finger is where the ligamentum teres goes. We're not too sure what this ligament does, but it probably supplies blood to the femoral head. So I've posed the question here, what would happen if the hip dislocated? What would happen to that ligamentum teres? The answer is it would snap. And it possibly would give you this, which is called avascular necrosis. Avascular means lack of blood, and necrosis means death. So I'm going to just show you now. The head of the femur has sort of died and gone a bit soft and lost its shape. So here's a few questions for you to think about. Why is it that the hip is a ball and socket? Why does it need articular cartilage? Why does the femoral head have an offset neck? Why do we need a glenoid or acetabular labrum in the shoulder and the hip? Is the capsule strong or weak in the hip? What directions can the hip move in? And why is that important? What would life be like if the hip was just a hinge joint? And next week we're going to look at the muscles of the hip. Thank you.